Welcome to Consulting Chaik and welcome to yet another episode on NABH, and this is about committees, and this is the third part. So let's get started. So today we'll be covering about these 7 committees. First one, Equipment Purchase Committee, then Disciplinary Committee, then Hospital Ethics Committee, then Grievance Committee, then POSH Committee, Quality Improvement Committee, and then in the end, Hospital Management Committee. Okay, so we'll start with Equipment Purchase Committee. So this committee should have major people from the management side, CEO, medical director, all these people. It should have biomedical engineer, your maintenance people, your medical superintendent, your nursing superintendent, who knows about which equipments are functioning, which are not functioning well. Okay, so these people are required. Okay, so Equipment Purchase Committee, they ensure that all medical and non-medical equipment is procured, which are procured. It is necessary, safe, cost-effective, and it is of standard quality. So they ensure that every equipment that they purchase, they are well specified, and as per the specifications only, the equipment is purchased. Okay, no over specification, and they also need to ensure that all the equipment companies, they ensure that the spare parts will be available, or those things needs to be cleared from the vendor side. Then the committee helps in rational allocation of resources and prevents unnecessary or duplicate purchases. Rational allocation of resources, as in if you need 3 monitors in one small observation area, or 10 monitors, you should not be getting you may have 2-3 extra for backup, but not double. Okay, and whenever some equipment is going down, they have to ensure and rationalize that how much of these monitors or equipment are required. Then they review and approve purchase request. So once they had specified, they have taken a quotation. The quotations are then analyzed in terms of the price, the specifications, their guarantee period, AMC price, and lot of other parameters, and then it is purchased. Then only it is approved for purchase. The purchase orders are given. Evaluates technical specifications and vendor credentials. Yeah, so as I said, during the analysis, they analyze it also in terms of the technical specifications I've already covered, and vendor credentials, how trustworthy these vendors are. So they may have certain certifications, whether they have those certifications or not. On that basis as well, the vendor will be evaluated and selected. Okay, next, the Disciplinary Committee. So it must have people from the management, nursing superintendent, all that, and HR, of course, and certain key people from the hospital. They should be there. So they maintain staff discipline and adherence to hospital policies. So whenever there is some breach of code of conduct, whenever there are certain situations where our staff has broken a certain rule which is not to do with POSH. In those cases, this disciplinary committee, they work. So they provide a formal mechanism to address misconduct or violation of rules. I have covered this. So whenever there is a misconduct or violation of rules, they analyze the situation, they see everything, okay, then they decide in unison. Then they review complaints or incidents following staff misconduct. Okay, this is different from grievance. This is disciplinary. So the grievance mechanism is different. In disciplinary, one complaint is given to the committee directly. They review everything and then they act. Conducts fair investigation, often with written notices and hearing. Okay, if the hospital may have different policies, different kind of rules for this. So generally, it's like if the disciplinary, if the misconduct is of very low intensity, then a verbal warning can be given in the first stage, then a written one, and then in third stage it can be a major decision can be made. So it can be suspension or it can be termination as well. Okay, so they ensure that this committee basically ensures that the whole staff of the hospital, they are all following the rules and the code of conduct. Next we have hospital ethics committee. So ethics committee, so if you have a DNB course in your hospital, so that can be combined with this. Okay, and if you don't have, then the general ethics, those things are taken care of. So I'll cover that, what we are seeing here. So they ensure that hospital practices research and patient care adherence to ethical standards. So if they are doing research projects, so they have to abide by the clinical research practices, where they take consents and all from the patients, and the patients, they know that their data are shared. So you have to do the proper process of this. Patient care is adhered to ethical standards. So even in general patient care scenarios, there can be cases where you have to adhere to, where you have to see the situation from an ethical angle, whether your process, it is ethical or it is going unethical. Okay, so those cases are all whenever certain cases like that comes up, or there is a breach of ethics, in those cases can be discussed how to deal with that. Okay, it safeguards patient rights, dignity and confidentiality. So the patient rights, we all know whether so the ethics committee, they ensure that the patient rights are followed and they are respected. The dignity and confidentiality, so certain vulnerable patients are our processes that we are following, they are all abiding by that, whether it is for the patient, are we safeguarding the dignity and confidentiality of the patients. So all those things are taken care over here. They review ethical issues in patient care, clinical trials or research studies. So I've covered this. Then they provide guidance on complex ethical decisions like end-of-life care or consent-related issues. So there we discuss. They maintain documentation of decisions and provide training on medical ethics. Okay, so this is the work. Grievance Committee. So Grievance Committee, they should have a member from the management, from the nursing, from the doctor side, and from the admin people. Okay, so what are we doing in Grievance Committee? So they provide a platform for patient attendance and staff to voice complaints or suggestions. So all kind of complaints coming from the patient side or the attendant side, and as well as from the staff side, those things are seen here. So staff side as in, so the patient side as in, you can discuss about certain patient feedbacks, certain complaints which are coming from the attendant side, and take a note of that and make changes in process or any other systems accordingly. And Grievance Committee, so we have a mechanism of raising grievances. So it's like if there can be in 4 levels. So when, say for example, a staff nurse has a grievance, first she raises it to the in charge. She waits for at least 3 days, 4 days. This is all according to the hospital. They can even say 2 days, 48 hours or 72 hours. Okay, and then if the in charge does not act, then after that time period is over, goes to the next level. They could do the nursing superintendent. Nursing superintendent, again, certain time limit is given, 3 days, 4 days, 7 days. Then nothing happens, then it goes to the HR. Nothing happens after the specified time, 3 days, 4 days, 7 days, then it goes to the Grievance Committee. Okay, so the hierarchy is respected and followed. Then they help improve patient satisfaction and service quality, of course. So when we understand where we need to improve, that is where we start making progress. They acknowledge grievance formally. Okay, so grievance in each state, they have to formally sign that I have received this. With that evidence, the staff has the rights that their grievance are heard, and if nothing happens, they can go to the next level. They investigate complaints, liaises with the concerned departments. Okay, so they investigate whatever grievance comes. This group of committee, this committee basically, group of people, they look after all kind of grievances. Then they provide timely solutions and inform complainants of action taken. Okay, they close these issues. All right. Now POSH Committee. So POSH Committee, it is different from the other committees. So here the chairman should be an external female person. Okay, it cannot be a hospital staff. That person should not be influenced by the hospital management. That person, preferably a lawyer or a social worker, will be preferred as a chairman, and all the other people, they will all be from the hospital. So they ensure safe, respectful and gender sensitive workplace. So though POSH is committee for sexual harassment against women, they also need to ensure that there is no false false claims. Okay, false complaints are made, so they need to ensure that it is all true. Mandatory under POSH Act in India, so aligning it with occupational safety principles. So all companies, they have to have this POSH committee. They receive complaints of sexual harassment from employees. So all places, all the working places where all the employees are sitting working, there this signages will be there that there is zero tolerance on sexual harassment. Please complain. If you have any complaint, lodge your complaint in these numbers. So this is a direct complaint cell. There is no hierarchy, nothing is taken into consideration here. They conduct inquiries and recommend corrective measures. So when the complaints are lodged, they investigate, they see whether those things are actually true, and then they after the investigations, they do the necessary actions. They provide awareness sessions and training on gender sensitization. So this is very important, that the POSH committee, they train not only the female workers but also the male workers or any other workers about the POSH committee and how they will be functioning, so that everyone they are all well aware about the consequences of sexual harassment. Right. Quality Improvement Committee. So Quality Improvement Committee must have the people from quality department, management, doctors, nurses, people from admin, they all should be there. They drive continuous improvement in hospital services and patient care. So after every audit, the points which are collected from the audit, those points are all discussed. If all points, but key points, those are all discussed here, and they always they tell how many points are covered, the percentage of progress. Those things are discussed over here. They ensure compliance with NABH standards and hospital policies. So after every audit, they do that. They identify areas for improvement through audits, patient feedback and incident reports. So from patient feedback, from internal audits, from incident reports and many other audits which are being done, all those things are discussed over here for solutions. Okay, then they implement quality initiatives and monitor outcomes. So quality, it's like it's never ending process. It's like cleanup. You have to clean up whatever, clean up as in say for example, there is a table and you clean the table one day, and again dust comes in, then you have to clean again, then clean again, then clean again. So the continuous improvement of quality, the continuous improvement of quality, it's never ending. Okay, you do more audits, you will get more points to work on, and from the quality indicators point of view, you always know that you can get better in terms of your discharge process time, your OPD waiting time, your turnaround time, certain infection numbers. So it's ever evolving, ever growing. Then comes your compiles points from all committees, escalates it to the management committee. So this is a very important point of a quality committee, that from all committee they take points about the points which needs to be escalated to the management committee. From those points they work on those points, and then they escalate it to the management committee. Now the hospital management committee, they need to sit every month. So from quality, whenever the compiled points, they all gather it here and then they discuss. Okay, so they oversee overall hospital governance, policy implementation and strategic planning. So from the top, they see the governance, policy implementation, they see the numbers, they see strategic planning. So ahead in future, what we are going to do. Okay, so the hierarchy of the whole committee, if you see, management committee, quality committee, and then all the other committees. So they work lot of points, all these committees by themselves, and certain points which they cannot resolve on their own, they escalated. The quality committee, they compile all that. They try to give solutions to all those points wherever they can do the solutions by the quality in their level, and whatever things where the management approval is required, those points are discussed over here. They also ensure effective administration and resource utilization. Okay, so these points are also discussed over here. Administratively, if from the quality indicators, the management indicators, certain things are not working out, then the effective administration and the decisions are taken over here. Okay, then they review hospital operations, finances and staff needs. So these points comes from the other committees, compiled through the quality committee. Then they approve budget, they do major investment and policy changes. Okay, so they don't get raw materials, but they get process materials from the down committees. Okay, so that they can make these decisions, and they monitor compliance with regulatory and accreditation standards. So the quality committee, they give them report that these are the problems, these are the things that we need to do. Then they decide on how to do that. Okay, and then they ensure coordination among different committees for smooth functioning. Okay, certain things that they need to pass it down to the committees, they also do that. Alright, so thank you. So thanks for watching this video till the end. I hope that you liked it. So please like, comment your views so that I can improve my content. Please share this with people you feel they should know about these things, and please subscribe. Alright, so see you again. Thank you so much.